Okay, I'm going to be talking about pancytopenia, which is a medical condition, not a disease, that is usually caused by some kind of underlying problem. Um, it's essentially your three types of blood cells: white blood cells, red blood cells, and platelets. All are dropped, bottomed out, zeroed. They're stopped being produced by the bone marrow, and you have to find the reason why. Um, Symptoms, like I said, are going to be low red blood cells, which would be anemia, low white blood cells, which would be like a leukopenia or just some other form of white blood cell drop that couldn't help you build your immune system back up. Low platelets is a thrombocytopenia. I actually had ITP when I was a kid, idiopathic. Those are three of the main things. There could be other things dropping with it. Since it's just related to bone marrow, you could have, hemoglobin, other things that would be zeroed out. That would be correlation to red blood cells and other things as well. So the etiology, a bone marrow disorder, which would be like aplastic anemia, leukemia, lymphoma, those kind of things. Some kind of viral infection sometimes, like Epstein-Barr. I think tuberculosis, from what I was reading, can do that too. Deficiencies in vitamins, like severe deficiencies, can cause your bone marrow to go out of whack. And then certain types of drugs. If you take chemo for a cancer, that could bottom out your bone marrow. A lot of times chemo does. It resets your whole body. It resets your whole bone marrow and start from scratch, so it bottoms you out on purpose. Radiation and chemo. Um, there's autoimmune diseases that trigger the same thing. They have to find an underlying cause of that before you could fix the problem of the low blood counts. Um, then there's some idiopathic things that they can't explain, and trial and error trying to figure out what's causing it. Um, so essentially, the anatomy and physiology of it. Red blood cells are a cell that would transport oxygen to the rest of the body. It takes oxygenated cells from the lungs, goes to the tissues, and in return, it uh, carries the carbon dioxide out of the body when like breathe out when you exhale. White blood cells are essential in your immune system, fighting infection. So if those are lower, you don't have an immune system, you can't fight infection. And then platelets are for clotting and basically prevent you from internally bleeding out or externally bleeding out if you get a cut or a wound somehow and you can't scab or clot. Um, let's see. A lot of splenism, it's called. I guess you can have issues with the spleen um, that would stop the cells from even being created in the bone marrow. Like they don't even get to that point. So it's not stopping the bone marrow from even making them. It's not even allowing the bone marrow to start making them. I guess that would be like damage to the spleen or some other underlying cause as well that would cause that. Prognosis, you could see if you could reverse it. You would look into like nutritional issues. If it was some kind of drug induced, where like chemo and radiation, or some kind of other medication that somehow caused it to collapse and fail. If you actually have leukemia, aplastic anemia, lymphoma, um, those would be the underlying cause, which would cause pancytopenia for sure. Um, Trying to figure that stuff out early and continuously is how you stop it from continuously reoccurring. Um, Supportive care functions, along with like specific treatments that we try to go through. You do some kind of blood transfusions or antibiotics, antifungals, antibacterials, things to try to make like a fake immune system to create one when you can't make your own, to help you fight off things that could be attacking your body since you can't fight them off while you're trying to get better. If you have any kind of cancer or autoimmune, a lot of times chemotherapy, some kind of targeted therapy, or a stem cell transplant um, are big. vitamin supplements, vitamin supplements, immunosuppressive therapy, things that would purposely bottom it out to like reset the bone marrows. Maybe you have damaged bone marrow, or you have bone marrow that isn't processing or being built the proper way. You would need to completely destroy everything left in it, and then it would restart on its own, hopefully the right way. Um, Maybe there was like a little glitch in the system of the bone marrow, and it wasn't producing the correct size, type, style, and you have to reset the whole body. So, um, so last year I actually had bone marrow failure, pancytopenia. Came out of nowhere. They thought I had aplastic anemia. They checked me for lymphoma and leukemia. I was hospitalized for a very long time. Um, all my counts were bottomed out. I was getting antifungals and bacterials and antivirals, and not doing so hot. And I almost had to get a stem cell transplant. And mine ended up being from, I had a little bout of, they thought it was strep. They gave me Augmentin, and it turned out I had tonsillitis and mono, which can't be treated with Augmentin. And I had it somehow, the Augmentin, which is like a penicillin-based, exacerbated the Epstein-Barr, which was responsible for the mono, and the penicillin mixing with the Epstein-Barr virus literally bottomed me out, and they kept giving me Augmentin to try to keep fixing it, and it kept making it worse, and they could not understand why. So once I got into the hospital and they put me on all these other medicines that were not penicillin based, my body magically got better. This is not before like 3 weeks of intense testing and sending out donor kits for stem cells to my friends and family, trying to figure out if I needed a transplant and why I was sick and what happened, and bone marrow biopsies and all that fun stuff. So drug induced can definitely be a big thing, and it's real, and this stuff is scary, and not having an immune system or red blood cells or platelets, just touching your body and bruising or running out of oxygen, anemia, like just fatigued all the time, it's scary, especially when you're just around someone normal walking in the park and you're getting sick. So thank you. That's Pancytopenia. My sources were clevelandclinic.org, stjude.org, and WebMD I used, and my personal history. Thanks.